The benefits of centering pregnancy are that, one, you have a 2-hour appointment with your provider for your prenatal appointments. You actually have more appointments than you would if you were just going to individual appointments. You're actually seen 10 times for centering pregnancy, plus some individual appointments thrown in there as well.
I feel like you have a lot more time to kind of get to know your provider and open up to your provider, and then hearing lots of different questions, you have that ability to think of other questions that might tag along.
We integrate educational topics during the centering sessions that correlate with where you're at in your pregnancy. You come in like you would for a regular prenatal checkup, but you also get education as an added benefit to that. We discuss different positionings. We have props that we use as a part of all of our sessions. The other session that we do is on birth control, contraception, and we have props for all of that as well. It just allows us to go into a lot more detail in 2 hours, an hour and a half to 2 hours, that you wouldn't be able to do in a 15 to 20-minute appointment. You also have a group of other people that are with you that have due dates that are within 4 weeks of each other, so it kind of creates a way for you to make bonds with other people and get to know other people that are pregnant at the same time as you are, and you can develop bonds and friendships and kind of go through pregnancy together and learn things from each other and create a support network. I enjoy this type of prenatal care over traditional appointments just due to the fact that it allows myself as a healthcare provider to spend more time with the patients and get to know them a little bit better. You are sitting with them in the centering session in the circle, having conversations with them while everyone's getting checked in, and I think it just adds the benefit of getting to see people in a different environment than just right in the clinic for 15 to 20 minutes. You really start to get to know what's going on with people at home, if they're having stresses at work, if they're having stresses with family members, and just all of the, the good things and whatnot. I think it removes some of the frustrations about prenatal care because of the fact that you do have more time with your provider. Our goal is to start on time and end on time. Sometimes there are changes that need to be made, but the goal is to have a set schedule so that people can plan for things, so that they're able to be here and just focus on their pregnancy and focus on the educational topic for the day. Have more time with their provider to talk about things that are most important to them in their pregnancy. The experience that I've had with the dads or the partners joining the patients here in the class is that they have an added benefit of learning what's going on with their partner in the pregnancy as well. I know that there are things that are discussed relationship-wise that are helpful too, just because pregnancy can be a time of stress and whatnot on a relationship, and I think it helps to talk about that with both partners present. There's also changes in the body that happen that a lot of times the partners aren't really sure what's going on, and it's helpful to have them here. It's also helpful to discuss and encourage couples to keep an open dialogue about what each other's needs are. And so having both people here and discussing that with them and encouraging that, I think, can help them when they're at home.
I'm learning about sleep and when the baby should feed and how you know what's wrong when it's crying and just basic stuff like that.
I love centering pregnancy. I think it's, it's very beneficial. A lot of people think that it's only for first-time moms, and it's for, however, what number baby you're on. It doesn't matter if you're on baby number 1 or baby number 12. We encourage people to come because not only do new moms learn things, but it's great for moms who've had babies before to mentor some of these new moms and tell them about what it's like to be pregnant and have a baby and what it's like to, parent and juggle parenting and relationships.